Let's speak with Dr. Tony O'Sullivan, co-chair of Keep Our NHS Public. Afternoon to you, Tony. You've heard all the arguments. I'm sure you've heard ministers like Steve speak on this before. I thought quite a lot of what he said was probably true, even if it was unfortunate that this is the kind of way our system works. What is your response to this overarching, rather disturbing headline?
First of all, I would say that we absolutely need value for money. If we're using public money, it should be spent very wisely. But when we're talking about what's happening, we need the evidence behind it, not just conjecture, not just ideology. And the NHS has always given us value for money, especially when it was funded to allow itself to meet the needs of the population. And up to 2010, and even up to 2015, it was rated the most cost-effective and most universally accessible health service for a major population in the world.
On what basis, just out of interest, it was most successful, did you say?
Yes, not in every department, but Commonwealth Fund in America compares mainly the Western economies every 2 or 3 years, and up to 2015, it always rated the NHS as number one. It rated it on the levels of value for money. It rated it on the levels of safety and on the availability of the services to the general population. But
not on outcomes.
Outcomes are very difficult because a lot of outcomes are related to poverty and other issues, including education, housing, child poverty, and so on. It actually performed overall as the best service in the world, putting all those parameters together. I would say that the headline from the Telegraph about the budget of the NHS doubling in the last 17 years is somewhat dishonest, really, because if you take the average inflation, and I've checked this today, that is between 3% and 4% for all of those 17 years. And if you add those together, and of course, inflation, a compound interest, if you like, 65% of that doubling of funding goes down to keeping pace with inflation and keeping pace with rising wages. And then on top of that, you have the rising population, which is very significant, as I'm sure you've covered a lot. There's the rising complexity of need. There's an almost epidemic of ill health in terms of long COVID, in terms of mental health, and also in terms of the rising complexity of conditions. As we are an increasingly aging population, which is a good thing, a higher proportion of people have 2, 3 or 4 long-term conditions. Stephen, I thought, made a lot of interesting points, which would have been good to discuss with him, and I'm glad that he believes in a publicly funded NHS. But he's just been in government for 14 years. And the decade of 2010 to 2019, the major think tanks that we look to for information on the NHS concluded that the NHS was 18% underfunded compared to the EU average. Now, over time, that underfunding has created the inefficiency that we are now commenting on. So it creates, for example, £16 billion backlog in the building of estates, the lack of repair of crumbling wards, and the lack of modern equipment to meet the needs. The waiting lists have built up with almost a decade of between 100 and 140,000 vacancies unfilled in the NHS. And those waiting lists mean that people deteriorate or die on those waiting lists. And when they do get treatment, the treatment is more expensive. As Stephen alluded to, there's nearly 3 million people out of work because of ill health, and that's grown nearly 1 million since COVID. And the lack of efficiency in the system, we're looking for solutions. It starts with the lack of social care provision. 13,000 patients on average are in hospital ready for discharge, but nowhere to go because of the lack of social care, residential or rehabilitation beds. Because of that backlog of people waiting for an admission to a hospital bed to begin their urgent treatment, 16,600 people have died avoidable deaths in 2024, and that was the Royal College of Emergency Medicine, down to delay in treatment. And that for me, that should be the priority.
Indeed, yeah, and certainly social care. It would be lovely to explore this more, and we will speak again, Tony, because I know there's a lot more to be said on it, and you speak with a qualified voice. I thank you for joining us today, Dr. Tony O'Sullivan. He is co-chair of Keep Our NHS Public.